and welcome to the St. Louis Minority Business Development Agency's Coronavirus Teams webinar series. Our mission is to ensure we offer resources to support small businesses to continue to thrive as we navigate COVID-19. I would like to acknowledge our director of the Missouri Minority Business Development Agency, Mr. Todd Gilliard, who is with us today. My name is Tamisha Taylor, and I serve as the administrative assistant to the coronavirus team. Today, our presenter is Dr. Kendra Holmes from Affinia Healthcare. Dr. Kendra Holmes is a North St. Louis City native and graduate of the University of Health Sciences and Pharmacy in St. Louis. She currently serves as Senior Vice President, Chief Operating Officer for Affinia Healthcare. Affinia Healthcare consists of 11 health centers, which provides primary and preventative health services to underserved residents of St. Louis City and County. Dr. Holmes oversees health center operations including medical, dental, behavioral health, urgent care, nursing, community outreach, laboratory, radiology, quality improvement, facilities, security, maternal, child, and unhoused services. She serves as Director of Pharmacy Operations, and today, Dr. Holmes will lead us in the topic, Workplace Safety and COVID-19. Join me in welcoming Dr. Holmes.
Thank you. Thank you guys for having me. Thanks to the St. Louis Minority Business Development Agency, Project Director Todd Gilliard, Dr. Herndon, and Tamisha for inviting me to discuss and provide some insight on COVID-19 safety and how minority businesses can really protect themselves during this time. So I am going to share my screen. Please let me know if you see that. Can you see my screen? Yes.
Not yet.
You
Not
can't?
yet. Not yet.
Not yet. Okay, hold on one second. Let me try one more time. How about now?
Yes.
Okay, awesome. All righty. So again, we are talking about the new normal, navigating the new normal of COVID-19 and insights on workplace safety. So basically, the pandemic, as we all know, has just transformed every aspect of our life, including how we do business, how we learn, socialize, and work. And a lot of people are really looking to return to what they feel is the new normal. And the goal of this presentation is just to assist the business owners and the individuals who are listening to navigate that new normal after the COVID-19 pandemic. I often caution when we're talking about going back to that new normal, because normal is exactly how we got to this point. So unfortunately, normal in St. Louis is that 21.2% of Black individuals live in poverty compared to 7% of white individuals. Normal is that African Americans are disproportionately represented in essential worker jobs. And that's exactly why we saw at the beginning of the pandemic, African American women in particular were the first individuals to contract and actually die from COVID-19, because we are those frontline workers who don't have the privilege to necessarily work from home a lot of the time. Normal is that there is an 18-year gap, a life expectancy gap between individuals who are born in the 63106 zip code, which is the zip code that I'm in right now, where our corporate office is located in North City, and 63105 zip code in Clayton. And that's definitely because of social determinants of health and systemic racism, which decreased the life expectancy of people of color. And normal, unfortunately, is that Black-owned business owners are twice as likely to be denied business loans as whites. Those have impact. That normal that we are looking to find again has impact. And the impact that we saw with COVID-19 is that Blacks are twice as likely to die from COVID-19 compared to whites. Hispanics are about 2.3 times as likely, and Native Americans 2.4 times as likely. That's not because we have any deficit or defects in our genetic makeup. Again, this is because of systemic racism, implicit bias, and not receiving the quality of health care that individuals who are not minorities receive. Another impact is that Black-owned businesses receive less than 2% of the PPP loans compared to white-owned businesses that received about 83%. As far as the timeliness of receiving those loans, it took about 31 days for small businesses with paid employees in the majority Black zip code to receive their PPP loans, compared to 7 days. That's 7 days longer than those in white majority communities. And you might say, 7 days, not a big deal, but 7 days is huge when you have about 2 weeks of cash on hand. That really makes the difference between if a business keeps their doors open and closes. And that's exactly what we saw. So we saw between February and April of 2020, Black business ownership declined more than 40%. And that was the largest drop across any ethnic group. Again, so when we say we want to return to normal, I definitely caution us, because normal is not equitable for many people. And in particular, it is not equitable for people of color. Again, in the learning objectives with this presentation, I wanted to discuss some of the mitigation strategies to decrease the spread of COVID-19 in your workplaces. Evaluate the benefits and challenges of vaccine mandates. I know there may be individuals on the call who have differing views about vaccine mandates. The reality is that vaccine mandates are here, and they will continue to be in different avenues of business and in our lives. I want to evaluate a therapeutic option that many in the minority community are not aware of, and then just finally describe some resources available to employers, and of course take some questions. So mitigation strategies. I can't stress enough that any business needs to have a symptom monitoring policy and procedures for their employees. You need to have intact a screening process where your employees are screened for the symptoms of COVID-19 prior to them presenting to the workplace. That can be accomplished by phone, by text, by email, but it has to be done prior to the individuals presenting to the workplace. And this is just very key for preventing and reducing the risk of transmission for your employees and also for your customers. I've had questions recently about temperature checks, and at Affinia Healthcare, we do temperature checks. We've been doing that for our employees since just about the beginning of the pandemic. I will say that honestly, at the beginning of the pandemic, there was less of a correlation between individuals having a temperature and actually having COVID-19. By that, I mean that there would be individuals who did not have a temperature who were still positive for COVID-19. What we're seeing now more so with the Delta variant is that there is more of a positive correlation. So when you see those individuals who are symptomatic with a temperature of a 101 or 102, there's a very high correlation that they will be positive for COVID-19. So I would definitely recommend, again, all of the employers have a screening policy and also do temperature checks for your employees. And again, the point is to prevent and reduce the spread of COVID-19. And with that in mind, you do have to take a look at your PTO and your leave policies. One thing that we've also seen at Affinia Healthcare, just as far as during our testing efforts, is that employees will often lie about their symptoms, or they will not disclose a positive result because they don't have time or they don't have vacation. And of course, they need their money. So you do need to look at your PTO and your leave policies to make sure that they're not punitive, that you're encouraging individuals, if you do have symptoms, if you test positive, please do not come into work. That is very important. I know that may be difficult because we're all experiencing work shortages, but you would prefer to not have that person there as opposed to infect other individuals and potentially your customers. With all of these policies, it's very important to educate and train your employees. And that's not just a one-time meeting or a one-time email. There's just a lot of COVID-19 fatigue that we're all experiencing as far as the symptoms, as far as the policies. So we really need to reiterate over and over as much as possible what we want our employees to do, what the policies are. We were also discussing as far as the requirements or recommendations for individuals or customers that are coming into your establishments. I would highly suggest that you require customers wear face coverings in those public facing workplaces. We're seeing some establishments now that are requiring their COVID-19 vaccine card to be presented. That, of course, does create some issues, because we do know that there's a lot of hesitancy in the communities of color where some individuals are not choosing to be vaccinated. And that's why it's really important for you all as leaders and as business owners to communicate and to educate your staff about the importance of vaccination. Cleaning, I can't say enough about cleaning, disinfection, ventilation, and physical distancing. And when you talk about the new normal, we should have always been doing this. We should have always been assuring that our facilities were clean and disinfected. We should have always been making sure that we have proper ventilation, because there are many other infectious diseases, not just COVID-19, that we need to prevent. As far as physical distancing, that I realize that may be difficult in some businesses, but as much as possible to really promote physical distancing in your businesses. And when possible, we do see that transmission is decreased with outdoor events. So outdoor businesses, as much as you can, that it would be preferable as well. No, it's coming up on the colder months, so that makes it more difficult. But again, transmission is decreased with proper ventilation in outdoor settings. And finally, vaccination. I know, again, there's a lot of politicizing of vaccination, a lot of individuals who do have some hesitancy, rightfully so, particularly in communities of color, to have a fear and a distrust of the medical system, because quite honestly, the medical system has not been trustworthy for people of color historically and presently. So we do need to understand that there are going to be employees who are hesitant to be vaccinated, and then just to provide them the information and education that they need to make an informed decision. And the facts are really the facts. And the facts are that unvaccinated people are 17 times more likely to be hospitalized with COVID-19. We are not seeing people in hospitals who are having numerous adverse reactions to the vaccine. If that were the case, my presentation would be a lot different. We are not seeing tons of individuals having adverse reactions to the vaccine. We are not seeing tons of individuals dying from having the vaccine. What we are seeing is people dying and being hospitalized because of COVID-19. And again, we completely understand the need and for increased education and the rationale behind vaccination hesitancy, but these are the facts. And again, as leaders of your businesses, as leaders of the community, we do need to get the word out to educate our community as much as possible. So vaccination, it is our best defense. You're aware of the 3 vaccines that are available, the Pfizer, Moderna, and Johnson & Johnson vaccines. I have read the studies probably 15 times. I have read the emergency use authorizations probably 15 times, and I can tell you that these vaccines are safe and highly effective at preventing illness, death, and hospitalization. Is any vaccine 100% effective? No. There is no vaccine that is 100% effective, but these vaccines are 80 to 90% effective at preventing, again, illness, severe illness, death, and hospitalization. That, again, is not to say that you will get the vaccine and you will not develop COVID-19. There are still cases, breakthrough cases that occur, but what we are seeing is that those cases are often much more mild and or of shorter duration than individuals who are not vaccinated. Information about the boosters. So there have been taking a lot of questions about the boosters. And currently the FDA is really advising only those high-risk individuals to receive the booster. And that's anyone 65 years and over or at high risk. So individuals who are immunocompromised, sickle cell patients, HIV patients, cancer patients, specific guidelines for who can receive that. Recently, the FDA did include individuals who are high risk. So that would include healthcare workers. They're also including frontline workers, emergency responders, and also teachers. So we'll be looking to see that ramp up as far as additional individuals being allowed to receive the booster. Now, for the general public, we're not at the point yet where the FDA is advising that everyone 16 and older receive a booster shot. And for those individuals who may work with children, the vaccine is not currently available for those individuals under 12. We're hoping to see the vaccine approved for those children maybe around the fall at the earliest. But we do know that the vaccine is available for children 12 and up. And again, would highly recommend with consulting your physician that you vaccinate those children. So vaccine mandates, again, whether we agree with vaccine mandates or not, they are here. They are going to impact your businesses. They're going to impact, areas of your life. And historically, I hear a lot of people say that, this is against the Constitution. You can't, mandate vaccines. The United States has been mandating vaccines since the Revolutionary War, when George Washington inoculated his army with the smallpox vaccine. So there is definitely historical reference for mandating vaccines. And businesses can legally require workers who enter their physical work site to be vaccinated against COVID-19. Now, of course, you cannot violate any of the federal anti-discrimination laws, so you definitely need to look at your policies and assure that they are across the board equitable. And when I say that, I mean that you can't have a business where you say, okay, all of my frontline workers or the people who work in the front office have to be vaccinated, but the individuals in the back don't have to be vaccinated. And it just so happens that the individuals in the front are African American women 40 and above. That is discriminatory because you are singling out a specific group and you put yourself at risk for an EEOC complaint. So I would definitely urge you to look at your policies or start beginning to work on policies for vaccine mandates. Now, you must make reasonable accommodation for workers who refuse. And we all know we're going to have workers who refuse the vaccine, either for a religious reason, a medical reason, or a disability. And so your policies must include those reasonable accommodations for those employees. Again, we know that some people are going to be reluctant to receive the vaccine. So incentives are very much being used in different businesses to persuade individuals to be vaccinated. I would caution you that you have to assure that your incentives are not coercive. So by that, I mean, you can't say that, okay, if you get the vaccine, I'll give you $3 more an hour. That's a very large incentive that the EEOC views as being coercive and really forcing an individual to take the vaccine. So as far as incentives, we've seen individuals, like $100 gift cards or tickets, or some people have even done a day off. That would be a little difficult for us because we're having so many issues with our staffing. But just really to focus on what those incentives are, if you will utilize them. And confidentiality. I can't stress enough about confidentiality with this entire process. It's not against HIPAA or confidentiality laws to ask an employee, have you been vaccinated, or to show proof of your vaccination. However, when you're asking individuals to complete the paperwork where there is protected health information about their chronic illnesses or any type of allergic reactions that they may have, that is protected information. It must be kept confidential. It cannot be used against an employee in a discriminatory way. And it also needs to be kept separate from their regular employee file, just to, again, assure an additional level of confidentiality. I'm sure we've heard about President Biden's vaccine mandate initiatives requiring employers with 100 or more employees to ensure that their workforce is fully vaccinated, or to require them to be tested weekly. We have seen that the fine that the president has suggested is a $14,000 per employee fine for employers who violate this mandate. We are definitely going to see this with employers with less than 100 employees as well. So now is the time to begin, again, getting those policies in order, because it's going to affect more employees and employers. As far as the testing, the Fair Labor Standards Act will require employers to pay their non-exempt staff for any time that they are gone testing. So it is really in the best interest of the employee and the employer to have the individuals vaccinated. In the president's vaccine mandates, he's mentioned that federal workers must be vaccinated, and also any contractors who do business with the federal government. You have to also assure that your employees have been vaccinated. So this impacts small businesses who may have federal contracts as well. And also, as far as the Medicaid and Medicare programs, nursing homes, adult daycares, any type of business that will receive Medicaid or Medicare reimbursement will also be required to assure that their workforce is fully vaccinated. The president has given the date of November 22nd for the vaccination of the federal employees. We're still waiting for guidance on those other groups, but we're looking to see that within the next couple of weeks, and probably by the end of the year, that mandate would be enforced. Medical exceptions. Again, there are definitely going to be individuals who will not want to be vaccinated and will provide a medical exemption. So for those individuals, the medical exemptions, that needs to be, again, kept confidential. You cannot use that information to discriminate against any of your employees. It needs to be kept confidential. And if provided, and I will say that there are very few medical exemptions that we have seen aside from a severe allergic reaction to the vaccine. But if a provider does state that their patient is allergic or has a medical exemption, we must abide by that exemption. And also the same with religious exemptions. So reasonable accommodations need to also be made for individuals who have religious beliefs or observances or practices that conflict with being vaccinated. Again, I would just definitely urge again to keep that information confidential, and not to use that to discriminate against any particular group, because you definitely set yourself up for an EEOC complaint in doing that. So we talked a lot about prevention. Unfortunately, we are going to see individuals who are or will be infected with COVID-19. And what our community really is not aware of, unfortunately, is that there is a therapy for COVID-19. This therapy has been in affluent communities, since almost last year or towards the middle of the pandemic. But we're now seeing the therapy more prevalent in underserved communities. So I will say that vaccination is absolutely the priority. These therapies are not a substitute for vaccination, but monoclonal antibodies, and I'll go into a little bit of the science of that, are highly effective at preventing hospitalization and death for individuals with mild to moderate COVID-19 who are at high risk. It's actually been shown to be about 70% effective at reducing the rate of hospitalization. And just briefly, what monoclonal antibodies are: they are man-made proteins, which basically mimic the antibodies that your body produces when you're infected with COVID-19. So it actually gives your body a head start. It gives your body a head start to build its own natural immunity against COVID-19, where the monoclonal antibodies are actually fighting off the infection. Your body has an opportunity to build its natural immunity. And I tell everyone that natural immunity is always the best. However, everyone does not have a great immune system. So for those individuals who don't have a great immune system, and there are a lot of us who don't have a great immune system, these are options for therapy. The therapy needs to be given within 7 to 10 days after the symptoms appear. It's available for adults and children 12 years of age and older. A very simple process. It's about a 30-minute infusion of the monoclonal antibodies. You are observed for about an hour. And just from my personal experience with seeing this therapy being administered, individuals feel just 100% better after receiving this therapy. And there's some information at the bottom about if you do have individuals who test positive for COVID, to call that number to seek treatment, to see if they're eligible for the treatment. But just again, often our community is not aware of the innovation or the therapies that more affluent communities are aware of, and we definitely need to get the word out. Resources. Of course, the Minority Business Development Agency is a great resource for minority-owned businesses, as far as resources for COVID, but also just as far as resources for employment and loans, and just resources for minority businesses. The SBA program also works to help minority businesses obtain government contracts and business loans. Very important. I would say that the city and St. Louis County Department of Health have excellent information on mitigation strategies, vaccinations. There is an entire area dedicated to small businesses, different resources that businesses can link into if they need it based on COVID initiatives. And also, organizations like Affinia Healthcare and myself, we are here to help if you need COVID vaccine testing, COVID vaccination. We work closely with minority businesses to provide those services at no charge. We want our businesses and our communities to thrive, because that's how our communities thrive. So we need our businesses to thrive so that we have jobs, and we have individuals who have health insurance. It's all a continuum. So working together, we definitely can make an impact. And if there's any way that I can help you with policies or resources, I am definitely willing to help. And I believe my contact information is listed. So if anyone has any questions, I would be happy to entertain them. And I believe I am no longer sharing.
Okay. Well, it looks like you're still sharing.
Oh, I am. Okay, let's stop.
Yeah.
How about now? My computer's a little slow.
That's okay. No, thank you so much for the information you shared. And I was busy taking a lot of notes, because having you as a partner, as well as Affinia as a partner in the health environment to support small businesses as well as mid-sized businesses to put in place those policies and procedures to make sure that we're meeting the needs of our community, our employees, and those we serve. So I wanted to just ask a couple of questions. And for those of you who do not know me, my name is Dr. Alice Herndon. I am the program coordinator for the coronavirus team, and I really want to make sure that we get a lot of information in front of you that will allow you to have resources available through the Missouri Business program that we can continue to support you. One of the things that you were talking about was symptom monitoring, Dr. Holmes. And you talked about making sure that we have policies and procedures in place. How do we maintain those? Can you just highlight that a reference that we might be able to use?
Sure. So the CDC has a great listing of all of the symptoms. Of course, I can give you the symptoms too, but the CDC has actually a section that is dedicated to business. So it outlines all of the symptoms that you need to look for, and it suggests that you have a point person. So and that sometimes may be difficult, but a point person where if an individual is experiencing these symptoms, that they can go directly to that person by text or email or call them, so that it doesn't get lost, because oftentimes we see that it kind of gets lost. Well, I told such and such I couldn't taste or smell. But there needs to be that one direct person that this information is shared with so that it can be disseminated.
Okay, okay, that's good. And do you also recommend for those businesses to have, when employees come into work, that they also list their temperature? Because you talked a little bit about signing in and temperature testing and how that can be utilized.
Yeah. So it's really important that if you have symptoms, not to come to work at all. So I can't stress that enough. Like, just do not come. So that really needs to be accomplished before they even hit the door. Once
Mhm.
they hit the door, I do recommend, if possible, that there is some method for temperature taking. Again, there wasn't as much of a correlation in the beginning with COVID, but now we're seeing it. You have 102 temperature, you can't taste or smell. It's a very high reason that you
Probability that
probability. Yeah.
And you also talked about face coverings and the necessity for utilizing those face coverings. Can you impress that even more? Because a lot of people feel that, well, I've been vaccinated and I may not need a face covering, or can you talk a little bit about that?
Yeah, and I think part of it was the communication with how the CDC communicated that, because it kind of went back and forth.
You right?
Um, and I think that really confused some people and just put a lot of people off to, like, forget it. But this is the thing. Even if you're vaccinated, and I want to emphasize this again, it's no vaccine is 100% safe. Absolutely not.
Right.
But there are individuals who still are asymptomatic, who are still carriers. So it may not impact you personally, but it may impact that customer who is immunocompromised, or that person who is on dialysis. So, and I think we kind of get away from community, and this is really what this is about, because it's about protecting yourself, but it's also protecting others who may not have, again, the immunity that you have. So face coverings, whether you are vaccinated or not, definitely if you're not vaccinated, but if you're around individuals who you don't know if they're vaccinated or not, you definitely need to have a face covering on.
Yeah, okay. That's good information. You also mentioned about how often should we disinfect and clean our spaces or our environments?
So it really depends on what type of business you have. And
Mhm.
there are strict CDC. The CDC has strict guidelines as far as restaurants in particular. After every family or whoever is at that location, all of the services need to be wiped down. This goes as far as to give the specific chemicals that need to be utilized for that space. And then again, what I talk about normal, we should have always been doing that, and
Right,
really
right,
should have always been doing that. But definitely those high volume, high utilization areas need to be wiped down after each usage.
right, right. And I think a lot of times, even now as we go and we re-engage in restaurants and things of that nature, we find that it's almost back to the old way of doing things. You
Yeah,
just see the person right after someone gets back up, versus allowing for the time of the disinfectant to become active or activate in that space to make sure that we're not transmitting diseases of that kind.
absolutely. And there is a contact time. So, and most people don't know that, but there is, like you mentioned, there's a specific time where you spray, where the disinfection occurs. So
Mhm.
yeah, I pay attention to, if I go to a restaurant and I see somebody get up and it's not disinfected, I'm like, you need to disinfect that area.
And see, that's the advantage that you have, especially as being working in the medical field,
Yeah.
where it allows you to say, okay, let me offer a little bit of information. Um, Signage. A lot of businesses feel as if people are just automatically aware. How important is it for small businesses to utilize signage that they can get in front of their customers or their clients?
So I think it's important for a couple of reasons. Number one, so that people, because people are fatigued and people forget. So I think that's important. But the other piece is that for our employees, and we experience this as well in healthcare, um, you know, your frontline employees don't make the policies. They're just there to do their job. And so we get people who are upset that, they are asked to wear a mask or, and to have that signage, at least your frontline people can say, look, the sign is right there, that the information is there. You saw that when you came in. So I think it's important to as a reminder, but also just to decrease conflict with some individuals who become hostile.
I know a lot of times, I think we had talked a little bit about this earlier, but a lot of times what I'm finding is some small businesses, they want you to inform them that you're going to enter into their premises, or they may keep their doors locked before they allow a person in, which allows them to be very upfront with that person as to what their policies are. What's your thoughts about that?
Well, I think that will give you time also to clean and disinfect. But the other piece is that we still have to make money, right? So you kind of want your flow to keep going and get your tables turned over as well. So I think you got to kind of balance that. I've seen that a lot in barbershops where
Yeah.
there's smaller areas. I think that's a great thing to do in really smaller areas. But in larger areas, I would hope that door is open so you can get that ventilation, that ventilation going
Yeah,
as
yeah,
much
yeah.
as possible.
You spoke a lot about the just going to shift just a little bit into the mandate that has been placed upon us, federal employees or government contractors and things of that nature. What about those that are fully remote, who have fully remote access or remote employees? Do you the requirement for those parties to be vaccinated, is that also going to be something that might be implemented, you think?
So the president didn't specify or make an exclusion for individuals who are remote. I can tell you a little bit about our experience, and this is that it appeared to us that some of the individuals who were working remotely did not get the vaccine, did not choose to get the vaccine. And we started seeing that those were the individuals who were developing COVID. So I think it creates a false sense of security, because just because you're not coming to work, you're still out at Walmart in the community. So we saw the people who were getting the virus were the ones who were not at work. So I think it needs to apply to them as well, because it creates a false sense of security, and they can still get COVID-19.
Right, right. So basically, nobody's exempt from the virus overall. We talked a little bit about those exemptions and maintaining those records of employees to ensure that they're kept confidential. And so we have the medical exemptions, and then we also have religious exemptions. And with that, you also spoke about not ridiculing those who have those particular exemptions in place because of potential of EEOC complaints. Can you talk a little bit more about that?
Well, I think sometimes when you have a smaller business, information kind of disseminates. And you may think that you're secure. We're a small organization. You still can definitely get an EEOC complaint and face litigation, because again, that is protected information, and the president's office has made it very clear that that will not be allowed, and they will enforce those individuals who are non-compliant. I think that what we are going to see is, and if you go on Facebook or social media, you already are seeing the fake exemption letters are being disseminated, as far as religion, as far as medical exemptions. I think you only take it so far.
Yeah.
You only take it so far, because once you go too far, then you're putting yourself at risk. So if you get from a physician saying that there's a specific medical exemption, you don't take it upon yourself to say, let me see your medical records. You don't take it to that point, because again, that's confidential, protected information, And at some point, you just have to take, if a provider is willing to put their license in jeopardy by lying to say that someone has an immune deficiency and they don't, you've done your due diligence.
Right, right, right. Wow. A lot of great information. I am so glad that we have you as a partner. I'm so glad to have Affinia as a health partner for the MBDA, especially the coronavirus, because the coronavirus relief program, that's one of the things that we have been implementing, making sure that we get a lot of resources available out to our business owners that they can continue to thrive and be successful as well as sustainable. Is if you have questions that you would like to ask at this time, I definitely want to make sure that we allow you an opportunity to share your questions or ask your question before we conclude today's presentation. I tried to have that conversation that to make sure that we were asking the right questions. Okay, so we do have a question from Mr. Ricky Fowler. How do we get the employer from being relaxed? Oh, I like that. So we have a lot of employers that become very relaxed, especially we're still in the pandemic.
Right.
And so you have people that will come into your office, so I'm going to fill in the gaps here if I can, Mr. Fowler. We have a lot of times where people want to come into your office, they become chatty and they don't have a mask on. I need 6 feet.
I think you answered that question.
Yeah, I think oftentimes people become so relaxed, but how do we say that in a safe way? Because that is still our employer, right? What's the best way that we could share? Are there some tools that you might recommend?
Well, I think that goes back to that communication of the policies over and over. And sometimes it's not just for the employee, it's for the employer as well to remember what their own policies are. But I'm a pretty upfront person. So I think that you just have to, if you're not comfortable, if you feel that your health is, threatened, you just have to let someone know, look, you are in my space, you're not following CDC guidelines. I think we need to be upfront and let people know what's going on. And that, that's with employers, employees as well.
Yeah, and say it in a respectful manner. I appreciate you sharing with me, but if you would just, I would like to give us a little bit of a distance where we can continue the communication. How's that? Did that work?
That works. That works. Yes.
Okay, I see someone typing, and I want to make sure that I make sure that I acknowledge your question. I believe it's Dr. Tiffany. So if you would like to share your question. Okay, here we go. So what do you recommend for institutions that have a very lax screening process? I'm able to enter most hospitals with obtaining a sticker with a date on it without any further questions. So I know that's loaded. That was loaded. That was loaded.
Yeah. So I'm for institutions have a very lax screening process. Well, I would start with sharing the CDC guidelines with those institutions. Yeah, it just would seem very unusual for a hospital or a healthcare organization. I can understand a barbershop or someone who's not healthcare is not at the top of their mind, but to not have a screening process for a healthcare organization is quite alarming, especially for an organization like us where we're constantly treating people who are chronically ill, who are at risk, already at risk and are vulnerable. Their health is vulnerable. So I would definitely just with management, just discuss my concerns and share the CDC guidelines with them and just really say that, hey, we need a better screening process. And honestly, that's how transmission occurs. That's how it occurs. People come in and they're symptomatic and they think maybe it's just a cold, and then they're not within 6 feet of you. You're indoors, and that's how transmission occurs.
Yeah, I know even some other small businesses that I've had the opportunity to work with. They, when I enter in, they have a hand sanitizer right there at the door. So I'm quick because I've touched the door, right, to enter in. So having that hand sanitizer there, but also having face masks at your counters, making sure that people are still covering and protecting. Um, that to prevent the transmission. um, so all of those are great things to have and have in place, but also sanitizing throughout the day to make sure that we're maintaining our space as people enter in. I know you, but I don't know the health of you,
Right.
right? And
Right.
so we just have to be mindful, to be very protective. It's not that we don't want to fellowship or things, because I'm a hugger, right? And I miss hugging people. I miss that embrace. Um, so it's allowed us to, I'm smizing, because you have your mask on, those types of things. And so it's a change for us. And I don't think we'll ever go back to what we perceived as normal. So we have another question. What is your recommendation for re-engaging employees back into the workspace after having COVID? And how would you go about educating those employees as what? Okay, I'm not sure what that means. But so if as a person is coming back into the workplace as after they've had COVID, how would you re-engage them back into the office?
So, and we experience that quite often. So I think it goes back to confidentiality as
Mhm.
well. So in the process of identifying, and smaller organization is going to probably get out. But I think that you definitely need as much as possible to keep that person's information confidential. If Kendra has COVID, I do not need you going around telling the people in other departments that Kendra has COVID. So I think assuring that the process of contact tracing is as confidential as possible. What we do when we have someone who is positive, we don't say Kendra Holmes is positive. You were in contact with Kendra Holmes on this day. We talk to that individual who is positive and we ask them who their contacts are. We send a letter, we send an email saying you were in contact with a COVID positive person. We don't provide that person's
Disclose
name.
the name.
We
Hmm.
don't disclose that information. We tell them what they need to do as far as testing. And I think that really helps because there's a stigma, unfortunately. And
Hmm.
it's ridiculous because anyone can get COVID-19. It's not that you're doing something that that is wrong. Anyone can be exposed. But unfortunately, with many infections and diseases, there's this stigma. But confidentiality is very important with re-engaging individuals, getting them back into the healthcare or to the business, and just your practices. So, don't go around and because the person comes back and you're spraying just on their desk. You've got to maintain the same standards that you're supposed to maintain for everyone at all times.
Right. And I see a little bit more was added to educate the staff as to not to offend that employee as
Right.
well. Because like you said, we got water cooler conversation that goes on, and people tend to share what they should not be sharing. And so in some cases, yes, it does get out. So the thing is to be careful not to ridicule those who have not had the vaccine,
Right.
as
Yeah.
well as to not ridicule those who have been infected with COVID. And because again, the likelihood that it can still be transmissible is still in effect. There's another question here for reference that hasn't happened at Affinity. However, I'm in and out of institutions all day and literally breeze by that front door most of the days. Given the nature of my job, this is a little problematic. Thank you for all of your insights. So thank you, Dr. Kendra. Are there any other questions that we might include for today's conversation? Because this is going to be recorded. It will be added to our website. So if someone may have missed today's conversation, please feel free to share it. So we'll see if there are any other conversations.
I will add that if any businesses need us to come to vaccinate their staff or to provide education for their staff, we are willing to provide that service at no charge.
Yeah, and that's what I'm saying about having Affinia as a partner. You're a partner in the community to make sure that education is available as well as any other additional support for businesses is also available. So thank you so much for sharing with us today and letting us know how we might be able to continue to move forward and be successful in business as well as maintain in our environment where we can be healthy. And so what I'd like to do is to share Dr. Kendra's contact information. Today's conversation was workplace safety and COVID-19. Our guest speaker was Dr. Kendra Holmes, who is the Senior Vice President at Affinia Healthcare. Her contact information, so please feel free to email her at this information available here at the bottom of the screen. So I'll allow some time for you to notate that information. So please feel free to contact her. And as she has shared in her conversation is that not only will Affinia come out to do the vaccines for your business, she will also come out and do education prior to that as well. So you definitely have a partner in Affinia Healthcare. I would like to also make you aware of the upcoming webinars that we have that will be coming available for the Coronavirus Relief Program in partnership with the Missouri Business Development Agency here in St. Louis. Our next webinar will be October 7th, which is a Thursday from 1 p.m. until 2 p.m. Financial opportunities, the do's and don'ts of financial opportunities, how you prepare to get that loan or secure the line of credit that you're looking for to support your business, but also there may be some information on bonding as well. So our CFO or our financial officer, Dr. Alan Green, will be the speaker for that day. And then following that, it's October 18th, I believe. Our guest speaker will be Leisha Reeves, and she's going to talk about pitching your business amidst COVID-19. So really getting in front of other businesses and being able to talk about who you are and what you do, because it has changed the atmosphere of how we do business with others. And then again in November, we'll have another conversation of setting goals amidst COVID, preparing for 2022. Our guest speaker for that day will be Coach Kim Burke, who is the owner of Let's Grow Institute. And so we have some awesome webinars that are going to be coming up, and we record each of our webinars so that way you can come back and review those on demand. My name is Dr. Alice Herndon. I am the program coordinator for the Missouri Business Development Agency's Corona Relief Program, and we thank you for being a part of today's webinar. Please feel free to visit our website at MissouriMBDA.com, and our office number is also listed below. Thank you again and have an awesome day. Dr. Kendra, thank you again.
Thank you.
All righty. Have a good day. And we can stop recording.